Hello, good afternoon, everyone. We are now in the session for the biosecurity in animal production and infection prevention and control in human health. So we are sharing knowledge across domain and protecting the environment and the ultimate one health approach. So let me introduce myself. My name is Nuriani Zainuddin as from the Indonesia, Director of Animal Health, Ministry of Agriculture, and as a moderator and me with Prof. Yep will be a moderator in this session. So we have four speakers today, and the speaker will be presenting about the topic for the we have Dr. Juliet Severin here with us to explain about the general concept of infection prevention and control in hospital and biosecurity in farm. And we have a Dr. Dinarti Cardono to presentation about the potential burden of lack of the biosecurity in cage fish culture in Indonesia. And we also have a Dr. Anissa Devi Rahmawati. She will be presenting about the biosecurity in Indonesian poultry farm. What are the barriers? And the last presentation with the Dr. Indri Roslamiati Supriyadi. She will be presenting about the infection prevention control in the hospital. Are we doing too much? So maybe the first presentation for the Dr. Juliet Severin, please. Time or Prof. Yap, do you have want to say something before?
I think it was a good introduction, and I think we will share the slides now from someplace. The file is uploading, I see, so it will come soon, I think.
Okay, please share the slide.
I think when the slides are there, Juliet can start.
Yeah, maybe while we are waiting the organizer to upload the slide, maybe you can share something, Prof. Yep.
No, I think this is the ultimate where the worlds are coming together from the infection prevention specialists from the animal side and the human side. And I think it's with there are differences, but I think today we are trying to find also where we can learn from each other. So I see that the slides are there now. So please, I know I saw that Rianne
Not
has.
yet. Yeah.
So
The
Rianne will help us, I think. Yeah.
Okay. While we are waiting the presentation, we have two different sector here. The first two speakers from the animal side sector and two speakers from the human sector. So the combination of the animal and human side is the One Health sector, yeah, to increase the implemented in our in our organizing. Also, so Rihanna tried to upload the slide. Okay,
Yeah,
I think
it's
shown now.
Yeah, I see them. And now put them in the full presenting mode. I don't know who is presenting them, but if you can put them in the full screen, that would be good. That is not working. I see. No, then we continue in this way. So
yes, we will continue this way. So so thank you very much, Rihanna, for giving us this technical support. So I will kick off with a general overview of concepts of infection prevention and control in hospitals. So I will call this IPC and biosecurity in farms. So I'm a medical doctor. I'm working in a tertiary care hospital in the Netherlands. I'm the medical coordinator of the unit infection prevention. So my knowledge is really skewed towards the human health domain. However, to address some very important challenges for the future, for example, the problem of antimicrobial resistance, we need a One Health approach, and I support that very much. So a One Health approach is a collaborative effort of multiple disciplines to attain optimal health for people, animals, and the environment. So in this collaborative effort, when we talk about IPC in hospitals and biosecurity in farms, and in this presentation of today, we will focus on the poultry farm and the fish farm, we have the same goal actually, which is to protect animals and humans by reducing spread of unwanted microorganisms. So next slide, this is the general concept. So we have a farm or a hospital, and what we want is we want to stop the introduction of unwanted microorganisms. So this can be bacteria or viruses or other pathogens. And we want to stop transmission of unwanted microorganisms inside a hospital or a farm. Yeah, you can please go back to the previous slide 5. Thank you. So this is what we want to prevent transmission inside the farm or the hospital, but we also want to stop the transmission of unwanted microorganisms to the environment, and also to minimize waste and pollution. And this is our link to what we call the green economy. But of course there are differences, and I will explain some of these, because in the farms, animals come in healthy or as healthy as possible, and farmers want to keep them healthy, mainly because of economic interest, of course. In hospitals, patients come in already sick, and the main aim is to cure patients, and we do not want to make them sicker. And we also have the task to protect healthcare workers from pathogens that may be dangerous for them. So, for example, what we do is when patients enter the hospital, we check them for risk factors or for symptoms that they may be a risk for other healthcare workers or for other patients. So we put them in what we call preemptive isolation, awaiting diagnostic results. And in the veterinary world, this would probably be called quarantine. So what I noticed in preparing this presentation is, are we really speaking the same language and using the same words? And I think this is important if we want to share knowledge. So next slide. One of the things that I encountered was the word biosecurity. Because, next slide please, what I know biosecurity of is when we talk about laboratories. So laboratory biosecurity describes the protection, control and accountability for valuable biological materials within laboratories in order to prevent their unauthorized access, loss, theft, misuse, diversion, or intentional release. But when we talk about farms and we look at the definition that the FAO is using, and the definition is very large, so you can see this on the next slide, and I will read out loud the first sentence and the last one. So biosecurity is a strategic and integrated approach that encompasses the policy and regulatory frameworks, including instruments and activities that analyze and manage risks in the sectors of food safety, animal life and health, and plant life and health, including associated environmental risk. So biosecurity, the last sentence, is a holistic concept of direct relevance to the sustainability of agriculture, food safety, and the protection of the environment, including biodiversity. So there are many definitions, and they're all summarized in a document that you can find on the internet, collected by the Biosecurity Office. So it's important that we keep this in mind. But for hospitals, we call this infection prevention and control. So this is a practical, next slide please, and evidence-based approach preventing patients and healthcare workers from being harmed by avoidable infections. And we have a lot of measures that we can take, but these all come with a cost, money-wise, time-wise, but also when we talk about patients, for a burden for a patient. So this is actually a delicate balance. And we really have to make, and next slide, please, good decisions and good choices there, evidence-based. And for this, we need to know what are the transmission routes and the reservoirs of pathogens, because we do a lot of things with these patients in the hospitals, and reservoirs can be patients themselves, but also the environment, medical devices, and healthcare workers can also be reservoirs and transmission vectors. So next slide, please. So when we talk about IPC, there are basic measures that we can take, and these are focused on hand hygiene and a clean environment. And then there are additional measures focused on special microorganisms and special procedures, for example, an operation. The good news, and next slide, is that there is a lot of guidelines out there and a lot of tools to help us in the hospitals to achieve our goals. And when we talk about this this basic measure, hand hygiene, there is a guideline from the WHO explaining all the evidence, and this is 270 patients, but it comes down to 2 pictures. So we have the 5 moments of hand hygiene and the how to hand rub. However, we see in daily practice that it's really very difficult to make healthcare workers be compliant with, for example, these 5 moments of hand hygiene. So this comes down also to motivation that we will probably discuss later on. So next slide, please. Another good news is that there is for hospital a lot of tools that we can use for self-assessment, all evidence-based. And I was actually looking if something similar is available there from, for example, the FAO, but I could not find it. I did find a biocheck, which is available from a commercial company in Belgium, for example. So this could be something that we could share. Can we really share these kind of tools for self-assessment to improve our biosecurity or IPC measures? So next slide to conclude. We have a common goal and a common concept, but sometimes we're using different languages, different focuses, and also different approaches. So I want to invite the audience to listen to the next speakers and see in the discussion how we can share knowledge and maybe share tools as well. So thank you very much.
So we go to the next speaker. That is Anissa. You are sharing by yourself? Yeah. Or yeah. Oh, Dinarti. Yeah.
Ibu Dinarti time, I think.
Yeah.
Yeah, thank you. Okay. Good afternoon, everyone. My name is Dinarti from the Center for Fish Health and Environment Assessment. I'm very pleased now and honored for the opportunities to talk to you about the potential hazard of the pollutant and lack of biosecurity in freshwater catch fish farming in Indonesia. Firstly, next slide, please. Firstly, I want to show you some picture about the freshwater fish farming cage in Indonesia. We see in this picture, it can be located either in the river, a lake, or reservoir. One we see here is the cage located in the river, in Batanghari River, Jambi Province, Riam Kanan River in South Kalimantan, and Das Citarum in West Java. Next. And this is the cage that located in the lake and reservoir. The picture in the left is cage located in Cirata Reservoir, and the picture in the right is in the Lake Toba, North Sumatra. Okay, next. Okay. Like you see in the picture, it all in the location share a similar thing. The use of a floating cage using a net that is open at the top and closed at the bottom, which lower to a certain depth of water level. That end was very close to one to another. Okay. The nature of the lake or reservoir or the river itself is a common property and open access. And it's usually used for any kind of activities like irrigation, water storage for domestic use, for recreation, for a hydroelectric power plant, aquaculture, and many more. For aquaculture, the freshwater fish farming is the common activity done. Culture fish in the cage at the lake, reservoir, or the river have some benefit by allowing for larger harvests than cultivation on the dedicated fish pond in the land. When this cultivation method was first introduced till a few years after, it plays a role in increasing national fish production. But the massively and uncontrollable growth of the cage in these recent years, with the addition of the lack biosecurity, some potential hazard from environment to the cage and vice versa was found. Next. Okay. With now increased activity in the upstream, like a chemical industry, livestock industry, agriculture, and domestic activities, the level of pollution from the environment to the river is also increasing. This even bring some potential hazard to the cage that located in the watershed. It then lead to the mass fish death, open the path for pathogen to enter the cage. Pollutant or contaminant could be entering the food chain, and maybe a possible introduction of resistant bacteria and also the economic loss. Next slide, please. Yeah, this is the example of potential hazard from the environment lead to the potential loss to the freshwater fish farming cage. The picture in the left was the mass fish that happened in Lake Toba, North Sumatra in 2018. Approximately 180 to 200 tons of fish died with 5 billion rupees economic loss. And we can see in the right picture, it's the mass fish death in Lake Maninjau, West Sumatra in 2021. The upwelling of the lake kills more than 1,000 tons fish in the cage, with the economic loss reach over 30 billion rupees. Next slide, please. And then what is the potential hazard from the cage to the environment? Before I explain this to you, let me explain the development of the cage number with the case in Cirata Reservoir. The picture in the left, you can see that just within 3 months, from June 2008 and to 27 September 2008, the catch number in Cirata Reservoir increased rapidly. Also, you can see in the right picture that from when the system, the cage, initially introduced, the catch number was increased rapidly from years to years. But you can see the productivity of the fish was decreased at some point in spite of the catch number was increased. What caused this? The answer is the decrease of the carrying capacity of the lake or river and reservoir. How it happened? Okay, next slide, please. Okay. These two pictures maybe will explain that question. When we raise the fish in the cage, we give some addition to the lake environment, like feed and maybe the fish drug and other chemical to ensure the successful of cultivation. But the improper feeding and medication lead some problems. The unutilized fish feed, which elevated the level of organic matters and nutrients, can lead to the phytoplankton bloom and also give the toxin to the water. Then the wrong medication treatment, like misuse of antimicrobials, leads to exposure of antimicrobial residues to the water. So this problem then come with consequences: biodiversity loss, disruption of ecosystem process, contamination of drinking water, and possible of antimicrobial residue entering the food chain and water for domestic and irrigation use that then could impact the human health. Next. And to minimize the potential hazard, some intervention was done, like the use of vaccine instead of antimicrobials to prevent fish from pathogen infection. Next. Yeah. Also, some revitalization project was conducted by the provincial government to return the function of the lake or the river and the reservoir, like the provincial government of the West Java. They promote the Citarum Harum project, which has program to regulate the cage activity in order to reduce the waste from the cage entering the environment. Next. And also, some regulation was made to mitigate the number of the cage for the sustainability of the environment. Thank you. Thank you. Hope you enjoy what I'm talking about. Thank you so much.
Thank you, Dinati. Really
Yeah,
great
okay.
presentation. And we continue now with Anissa.
Okay, thank you, Prof. Job, for letting me to start the presentation. Hello, everyone. Good afternoon. First of all, I would like to say thank you very much for the opportunity given, and it's a pleasure and it's an honor for me to be able to share to everyone here, especially the topics is about the broiler farm biosecurity, responsible inside and healthy outside. Next slide, please. So for this presentation, my outline will be we'll be talking about the poultry farm biosecurity in general, and then the broiler industry in Indonesia. Also, and then the next one is the situation found at the farm during the project that I am currently in, which is the Cornerstone project, and what to do. Next, please. So talking about the poultry farm biosecurity, as already mentioned by Dr. Juliet in the beginning, so the biosecurity itself has quite a lot of interpretation, but mostly it's a procedure or to prevent the introduction and the spread of the disease-causing organisms in a place, which in now we are talking about a poultry flock, so it's a disease-causing organism in a poultry flocks. So based on the CFSPH, Iowa State University, and the USDA in the 2016, they are trying to make the guideline for the biosecurity, and they also mention about the three categorization of the biosecurity, which is the conceptual biosecurity, the structural biosecurity, and the procedural biosecurity. Talking about this categorization, when we're talking about the poultry farm industry, the conceptual biosecurity can be explained by the location or the geospatial setting and orientation of the facility or the farm. And then for the structural biosecurity, is talking more about the physical factors or what things that can be built inside the farm to prevent any exchanging contamination from the outside to the inside and inside to the outside. And the next one is the procedure biosecurity, which is talking more about the routine procedure done inside the farm, including how the workers will do, for example, using the clothes that it's only can be used in the farm, or also disinfect their self before entering the farm. So basically, that's the biosecurity. And then when we are talking about this biosecurity, we would like to know what is actually the impact of enforcing the good biosecurity practices at the farm level. So by looking at the Cornerstone project, this is things that I personally can see by implementing the good biosecurity practices at the farm level. This is what they can actually get. First, it could prevent the introduction of the disease, and also prevent the disease outbreak happens in the flocks, prevent any contamination for the food product. For example, the contamination for the salmonella in the carcass, and then indirectly lower the use of antibiotics, and ultimately they will raise the efficiency of the production cost and will provide a good profit. And when we are talking about the impact of good biosecurity in the farm level, ultimately we're also talking about the impact of good biosecurity practices at a bigger community. So by practicing the good biosecurity in the farm level, we can prevent the outbreak happen in a bigger area outside the farm, and also prevent the contamination spilled out from farm to environment, and also to prevent ultimately extraordinary costs for any disease eradication or public health emergency. Next, please. So for the broiler industry in Indonesia, I would like to kind of share about how the house model and type of ownership will influence the biosecurity procedures in poultry farm. So according to Nugroho 2020 and AHK 2019, the house model in broiler farm in Indonesia, 60% of it contain the as a open house system, and 40% as a closed house system. And the type of ownership, 70% of them is independent integrator type, and there is 10% of it as a company owned in a large population and excellent farm, and then the remaining 20% is a completely independent farm. So seeing by this model, we can know that in open house model, as you can see in the picture in the right side, the open house system will definitely expose the chicken or expose the farm to a bigger contamination, and also a bigger possibility to get infected by any other disease, because it's a open house system. While in a closed house system, it's more, because it's closed, it's easy to maintain, but of course higher cost needed in the beginning of it. And also by seeing the type of ownership, we can see that 70% of the broiler industry integrated with a bigger company. They provide chicks or they own chicken. They provide feed. They provide the medication. They provide technical advisors, but they do not really provide the biosecurity protocols for each of their partners. The 10 remaining percent of it, which is owned by the bigger company, mostly they have their own biosecurity protocols, but 70 and 20% do not really have biosecurity protocols. Next slide, please. And since I am now in a project of a Cornerstone project, which is actually talking a lot about the antimicrobial use and also the AMR or antimicrobial resistance, we're also trying to see a biosecurity level in the farm. So to sum up a lot of findings in the farm, I try to separate it into four bigger picture here, which is we can see the chicken, the workers, equipment or farm design, and also the environment. By seeing the chicken itself, the things that I would like to share is like a lot of the farm do not really have the proper way to discard their dead birds. Also, they have the problem of uncertain DOC quality that they actually receive, and there is no isolation room, only separation for the sick and healthy birds. While for the workers, a lot of them still unaware about the critical biosecurity procedure, and also a lot of the workers in the farm do not receive any refreshment for the biosecurity protocols. For the equipment in the farms, foot bath or vehicle sprayer with the disinfectant not placed in all farms. And also there is almost no special clothes or footwear could be found in the farm where the study is in. And also for the environment, we also found out that some of the farm have untreated manure as a fertilizer, and also there is some production waste improperly thrown away, including the dead birds. Also, there's wild birds and pet birds living in the farm, and pests, including rats and also bugs, really hard to control. And a lot of farm also located very near to the community and the main road. Actually, all the factors above alone and combined, it could contribute to the worsening farm condition, and in a bigger and in a long term, definitely could affect the environment. This is the picture in your right side. It's how the situation that we can see there. So in the first picture, you can see that's a pile of dead birds, really near the main house of the chicken, and below it there is a tree, and then a lot of waste products and dead birds put under the tree. Also, we found there is a food bath, but there is no disinfectant until the end of cycle. Also, there is a pet birds live inside the farm, and pile of bugs live inside the house of chicken without in a very long time. Next slide, please. So in what to do, so that's our main question. In maybe all of us here attend this session to ask, so what to do. So the answer is actually the implementing the One Health concept itself by, of course, by trying to make everyone knows that human health, animal health, and environmental health are related to each other. So it's really impossible for us to stand alone and fight for our own sectors. It's really helpful, and collaboration of the key players are really important. The collaboration from the government, from the private sectors, from the NGO, the educators, and also the owner of the farms or the business owner is also really important. In our project, in the Cornerstone project, we're trying to do a lot of intervention, and specifically in biosecurity, we're trying to talk to the farmers quite intense, and also try to give them the encouragement of how important the implementation of biosecurity is for their farms. We're also inviting them to a more formal session to discuss as well about these matters. Next, please. This is the acknowledgement. Next, please. Next, please. And this is the ultimate slide of mine. An ounce of prevention is worth a pound of cure. So biosecurity is to prevent, and to prevent is always better than the cure. So thank you very much for the opportunity. Thank you, everyone.
Thank you for the presentation. Maybe for the next presentation from the Indri Roslamiawati. Please. please, time is yours.
So thank you, Dr. Yudani. So hello, everyone. So thank you for the opportunity. So I'm Indri. So I'm from the Health Development Agency of Ministry of Health. And I will give a talk about the infection prevention control in the hospitals. Are we doing too much? And this talk is based on the result of our study in hospitals in Indonesia in 2021. Next slide, please. So the infection prevention control is an evidence-based approach preventing patient and health workers from infections, and is also a key to safe patient care. And the Ministry of Health of Indonesia issued a regulation regarding to this. And also the WHO issued a tools, which is Dr. Juliet already mentioned before. It's called IPCAF. So IPCAF is the Infection Prevention Control Assessment Framework that issued by WHO to find an assessment, a baseline assessment of a structured questionnaire with an associate scoring system that can provide a baseline assessment of the IPC program and activities within the healthcare facilities. So IPCAF itself contains of 8 core components. So the first core component is IPC guidelines, followed with IPC program, education and training, healthcare associated infections, and then the last one will be the environment, materials, and equipment for the IPC. Next slide, please. So we know that the COVID-19 hits the world in 2020. And when the COVID-19 hits the world, the healthcare workers are our frontliners that have direct contact with the COVID-19 patients. And one of the preventive measures is the personal protective equipment. So the WHO recommends the rational use of the PPE to protect healthcare workers, to protect themselves and prevent transmissions in the healthcare settings. And it's proven to protect healthcare workers from the risk of contracting of COVID-19. And the Ministry of Health of Indonesia issued the guidelines or technical instruction for the use of PPE for coronavirus in April 2020, and it remained unchanged until now. So the guideline itself contains of the description of the 15 different situations. So next slide, please. However, there is no baseline assessment about the IPC programs and activities in the hospitals. And also the implementation of the PPE guidelines against the COVID-19 have not been monitored yet. And the next question will be, how about the use of the PPE? Are they overuse, underuse, or the correct use of the PPE to the guidelines? And the next questions is going to be the hot topic will be like, what is the impact of the PPE on the environment? Next slide, please. So the SDGs. So the SDGs are a collection of the 17 interlinked global goals designed to be a shared blueprint for peace and prosperity for people on the planet now and into the future. And the 2030 agenda says that the SDGs are integrated and balance the 3 dimensions of sustainable development, such as economic, social, and environment. And since the COVID-19 outbreak, increased production of plastic-based PPE equipment has been rapid. For example, between 2016 and 2020, the compound annual rate of increase in the global market for PPE was 6.5%, approximately from 40 billion to 58 billion. This is quite a change. In contrast, the WHO projected that PPE supplies must increase by 40% monthly to deal effectively to the COVID-19 pandemic. So therefore, because we are talking about the overuse of the PPE, then the goals of the SDGs that interlink with our goals is the goals number 12, which is the responsible consumption and productions, and the goals number 13, it's a climate actions. Next slide, please. So therefore, we conduct a study. So this is a cross-sectional survey we conducted online in July and November 2021. So the samples are 20% of all total number of general hospitals in Indonesia. And we conduct a stratified random sampling based on the classes of the hospitals and the regions. And here are the details of the samples. And in the end, we invited 475 hospitals to join our study. And we invited them into the into the introduction meeting, and we explain about the study, and in the end, we share the link of the questionnaires, which is conceived of the IPCAF questionnaires as well as the PPE questionnaires. And the end, they will fill in the questionnaire and submit again to us, and 10% of the participating hospitals were interviewed. Next slide, please. And these are the categories that we use to interpret our results. And for the category of the IPCAF scores is based on the WHO. So we can see here there are 4 categories, starting with the inadequate, which is the lowest categories, the basic, intermediate, and advanced as the highest categories with scores of 601 to 800 points. While on the other questionnaires about the PPE, we have also 4 categories. So the first one will be the underuse of the PPE, which is less use of PPE than required by the guidelines issued by the Ministry of Health of Indonesia, and the use of the cloth mask. And the compliance, which is the correct use of the PPE based on the guidelines. And the overuse is a category of compliant plus the use of 1 or more extended PPEs, or the non-compliant plus 1 or more extended PPEs. So the extended PPEs are the coverall, the double mask, and then the N95 in some of situations that did not occur the aerosol generating procedure. And the last category will be the under and overuse, which is the use of PPEs both under and overuse. Next slide, please. So this is the distribution of the participating hospitals. So from 475 hospitals that we invited, there are 355 hospitals participated with a response rate of 75%. So we can see here all the hospitals are well distributed throughout the region of Indonesia, which is a big one. So next slide, please. And the result of the implementation of the IBC in hospital in Indonesia is mostly in the category of advanced, about 56.9%. And as I said before, there are 6 core components. And here we can see the mean score of each core components. And our strength for Indonesian hospitals is the IBC guidelines, while there are 3 core components that need to be strengthened. It's the education and training, surveillance of highs, and multimodal strategies. Next slide, please. And for the implementation of the PPE guidelines in hospital in Indonesia, we can see here that there are 4 classes of hospitals, and there are 3 regions, and also the ownership of the hospitals. But however, all of the characteristics shows that the use of the PPE in Indonesia are mostly overuse. So next slide, please. And this is, we pointed to the more to the, I think the slide is changed.
I don't know what happened. So,
yeah.
Rihanna, can you,
Okay, so we can continue. So now we will focus on the use of the extended PPE. So we know the extended PPE is not recommended with the guidelines. So there are coveralls, and then there are double masks, and also the use of N95 in some situations. So I said before that in the guidelines of the Ministry of Health, there are 15 different situations based on the providing direct care or not, and then based on the occurrence of the aerosol generating procedures and the personnel and also the locations. So here we can focus on the 3 things, which are the coverall. We can see here that coverall is not recommended by the guidelines and also by the WHO or the CDC, but we can see here that hospitals are still using the coverall in all situations. And for the N95 mask, it's also used in several situations that the aerosol generating procedures did not occur. And the last one is the use of the double mask. So we can say that double mask is not recommended as well in this guidelines. So overall, that the use of the extended PPEs happens in most of the hospitals in Indonesia. Next slide, please. So as I said, that 10% of the hospitals are being interviewed by us. And then we asked them about the challenges in implementing these PPE guidelines. And the first challenge is the excessive use of the PPE. So it's more than required by the guidelines from the Ministry of Health, especially for the use of the double mask and the coverall, which is in line with our result from the previous slides. And also there is one interesting issue that raised only by one hospitals is the PPE waste. So we know that single use of PPE has played major role in preventing COVID-19 infections. And since the beginning of the COVID-19 pandemic, the demand of use of the single use of PPE has been raised dramatically. However, the use of COVID-19 global pandemic necessitated that PPE is now mainly used in domestic situations, which is leading to the shortage and supply chain and rapid accumulation of potential infectious PPE in domestic solid waste streams. But unfortunately, this issue is not recognized as a challenge in the hospital in Indonesia. So there was not yet awareness regarding to this. So I think these issues should be disseminated more, and we should be aware of these issues starting from now. Next slide, please. So however, there was this report by the Healthcare Without Harm, it's an international NGO about the healthcare's climate footprints, how the health sector contributes to the global climate crisis and opportunities for the actions. So here we can say that the healthcare's climate footprints is equivalent to 4.4% of the global net emissions. And the report also divided the global healthcare emission by production sector. So we can see here that the biggest one, of course, is the electricity, gas, heat, or cooling. But there are two sectors that are related with the overuse of the PPE. The first one is waste treatment, is 3%. And the second one is the rubber and plastic products. So we can see that the clothes made from rubber, and then, there are lots of single-use PPE that use from plastics. So they are becoming the problem as well. And so there's a journal from the environment, a journal saying that the medical waste generation has increased 25% in 2019 to 2020. So from 2.26 to 2.83. So I think we have to put more attention to this. Next slide, please. So as conclusion, so the IPC core components are implemented quite well in Indonesia, especially regarding to the IPC guidelines. And when the hospital follow the guidelines, they are mostly overused. And the impact of the overuse of the PPE on the environment is a large waste of plastic, which is, I think, it's going to be the big concern for the world. And the improvement is to be made, especially to overcome the overuse of the PPE, like knowledge sharing, more to disseminate the regulations and the guidelines related to the PPE, and the policy that is more environmental friendly, especially for the single use of the PPE made from plastics. And I think this one is really important to raise awareness. So as we know now, we have so many platforms that we can use to raise the awareness, like Instagram, TikTok. Now we can use the TikTok to tell the world that, okay, this issue is quite important now. And the last one is to minimize the single use of the PPE that can contribute to the plastic waste. So next slide, please. So this is the acknowledgement, Ministry of Health, Erasmus MC, Indonesian National Working Group of IPC, the UMC Utrecht, and also the LPDP for the funding. And I think the last slide will be thank you. And I would like to say thank you for all the healthcare workers that already work hard to be our frontliners in combating the COVID-19. Thank you very much.
So thank you. That was the last presentation. I think we had a very nice combination of human side and the animal side, underuse and overuse. And first, sorry that my camera is switching on or off all the time. That's not that I do that by purpose, but what I like to ask if there are questions from the audience. I saw one command from the audience. from Syamet Supriyadi Wastra, who said, now, environmental pollution topic in Indonesia is very interesting. If there are questions from the audience, please put it in the question and answer, so then we can pick that up. First one, now I leave my camera out, otherwise it goes on and on. One correction for in Juliette's presentation, she said that the biocheck is from a commercial company, but it's from the University of Ghent, from Professor Jeroen de Wulf. So it's not a commercial product, but it comes from the university. So that's the correction. I will start the discussion then when there are no questions from the audience. The discussion with the presenters. One is what very now nice, but also at the other hand very worrying remark from Dinati was that the lakes where the animals were kept, where the fish were kept, you said you used the term carrying capacity. So there was too much environmental waste to keep the animals alive. And that is really from the principle of having the carrying capacity is. I'm wondering if that also is happening on a larger scale with, for example, what Anisa presented from the poultry farms, but that the buffer of the globe is bigger, and you have more, and I would not say micro environment because Lake Toba is quite big, but there you find out that there was something wrong with the system. The system gave you a warning and said this is not right, and this is really too much contamination for what we can handle. But are we not on the same way? Maybe it's a kind of negative aspect, but on the same way with what is also putting into the environment from poultry, and that still the buffer of the globe is big, and that we do not see that yet, but that we are finally working towards the same situation. And that the warning from Dinati's fish environment is a warning for we have to be very careful with what's happening also on another scale with poultry farming or pig farming. So Anisa, what is your opinion about it? You are the poultry and the one who is working on that. It's a very holistic question.
Yeah, thank you, Professor Yap. Yeah, I think definitely it's really hard for us if we're, as I mentioned before, if we're working and mainly only for our sectors. It's, for me, it's almost impossible to prevent the contamination in a bigger or in a larger environment. But now that we are doing this talk now, I think it's a quite enlightening for us as speakers, and also in the bigger audience, that we can give them a really clear and real situation for now. That from Ibu Dinarti's presentation, that as you mentioned, there is an alert from the environment itself that it's contaminated. There is something wrong with our lake. And me as I'm presenting about a very small part of why the contamination can end up in that place. It's one of the reason is there is something wrong, I think, with the waste management in the poultry industry. It's not a mistake, but there is something that needs to be fixed, or there is something need to be done in creating a better situation for that. And also in human sectors, we also can see things alerting happen, but in quite interesting things that while in our side, for my experience, the biosecurity including the usage of the PP and stuff. It's underuse and there's overuse. So the balance is the key to create a better health for all. I think that's what my what I can say.
Maybe the alert from the Nati, I think comes from the economic point. So the fish farmers were forced to change, or were also probably willing to change, because there was they had an economic damage because the fish were dying. And I'm afraid that as long as there is not an economic incentive for, let's say, poultry farmers, or also that is also for dairy, but I will come to the hospitals. But when there is not an economic incentive to do something, that people said, okay, let it go, and that we have to wait for that sign from the environment that gives a really okay, this is a no-go. And that, I think, was quite unique in the fish farming, that there was an immediate economic damage for the farmers, and then they act. But I think as long as we can contaminate the environment and there is no economic damage, then for the ones who are polluting, then I think it's either strongly dependent on regulations, but they are not willing to do that by themselves, I think. But that also brings me to the hospitals, because what we are talking, and Juliette was talking about, how is that handled in hospitals? But when we are talking about microorganisms and antimicrobials, Juliette, you didn't say anything about that, but to blame your sector, here you see we are still different sectors. But there is also leakage from hospitals, and becomes now more and more get more attention. That it doesn't stop with the sewage system of the hospital when people go to the restroom, so there are a lot of contaminants also coming out of the hospitals. But is there a system who is responsible for that?
I cannot answer this question, of course, for the Indonesian setting. I'm also not really sure about the Dutch system, but I think every hospital has an obligation to make sure that the water that is provided to the water management system, so back to the municipalities, that it should be treated in some way. So we have there are a lot of developments going on, and that's in that aspect, how to treat the water to get rid of antibiotic residues, to get rid of resistant microorganisms, but also other kind of pollutions. For example, medications. A lot of medications you also do not want to spread out in the environment. For example, medications that are used in oncology. So there is a lot of development there. In our hospital, we have a dedicated water treatment system. So all the water that we give back to the city is completely treated, and it does not contain any residues of medication or any microorganisms, so no viruses as well. So it's treated very well, but this comes with a cost, of course. It's a very big machine that's doing this work. It's costly, of course, but I think when you look at a global scale, this is definitely something that needs attention. Because there are also hospitals, and I know in Indonesia the water is treated, but it's also given back to the rivers. So if the hospital wastewater is going into the rivers, and there is medication there's antibiotics, there is maybe resistant microorganisms or other pathogens, that will have an effect, especially if these rivers are used by people to wash their clothes, for example, or for just for swimming, or for fishing. So everything is connected, and every domain should do its part. But of course, it comes with a lot of costs to do this.
Yeah, and that there, when we look for commonalities in between the systems, I think when we are talking about hospitals now, that and I don't know how many there are, but that's a number that is still limited. And what you say, it comes with costs. But when we look for the units that contaminate, when we are talking about farms, and they have to do something with the contamination of farms, so the fish farms from Dinati or poultry farms from Anisa, and it comes with costs, then also that's almost impossible, I think, to make systems that like in your hospital, there you can share it with many people and other costs and whatsoever. But when it has to be paid by an individual farmer, that is impossible, I think, to do that. But maybe Dinati can. But how do you see a solution for this pollution, Dinati? Do you think that treatment, or any treatment is impossible, I think, or not?
Sorry, Prof. Can you repeat again?
Yeah, so when you are talking about treatment of wastewater, I think for fish farming, it's impossible to do any treatment of wastewater. So it's just to prevent what is going in, and what you say, you are using vaccines that prevents at least some of the antimicrobial use. But do you see any, let's say, post treatment treatment of the water? Is that possible, or do you think no, it's really, that's impossible to do that? Or is there work done also to lead the water to other places where it can be treated or inactivated by sunlight, or I don't know what for kind of systems there are?
Yeah. Actually, what we're done now in Indonesia to prevent the wastewater, like the government create regulation of the how many cage that could be in one lake or in the river, something like that. And also maybe they they also do the some waste treatment. Oh no, they just pick the season for the cultivation. The waste in the lake will be the upwelling even in the lake is happened mostly in the rain season. So the cultivation we'll do in the dry season to minimize the consequences of the upwelling. Maybe something like that, Prof. Yap?
Yeah. Okay.
Is it
Yeah. So then,
understandable?
yeah.
Sorry.
Then it's more to adapt the system, that it just that the carrying capacity of nature can still handle what is done
Yes.
in a certain moment of the year. Yes. So,
Yeah.
yeah. And then I think I see some commonalities and also some differences. And one of the differences I wrote down was that Juliet and Indri are talking about patients. So they have 10 patients, or maybe 100. But Dinati is talking about I don't know how many fish are living in these cages, and Anisa is talking about 20, 40,000 chickens. So there, I think we have different scales also. But it's nice to look for the commonalities. And one of the commonalities, I think, is also, Juliet, you talked about, and now we have 4 minutes left, about a book of 260 pages. Finally, you could bring back to 2 figures. But I think the hand washing is not done in the right way. Like with Anisa showed, that the boot in disinfection is not done in the right way. So I think we need these nudges to to make people aware of what is happening. And that is a question from Indri. Usually we have not a good compliance to the biosecurity or the IPC or biosecurity. And now you show that with the corona that there is a huge overreaction. So is that because of the fear that people became? So it was more direct. It was a lot in the news, and there was a lot of attention for it, and it has a direct consequence for the people who became infected. Whereas when you are in a hospital and you want to prevent the spread of a resistant microorganism, if that happened for a nurse, it has not an immediate effect, I think. Is that the reason why you see now the enormous overreaction with COVID? Or what is the reason that we are trying to do this, but only now there was a huge use of protective clothing?
Okay, so thank you, Professor Yap. So actually, so we have several interviews, and the most interesting things is that the compliance of the health and hygienes are increased dramatically in all hospitals. Like mostly they are like 100%. So I think you are right. Like the expose of the COVID-19 to the patients and also to the healthcare workers that really insist them to provide the safety for themselves. So for the PPE, so actually, so this, because what we did is like we monitor the implementation of the guidelines in the hospitals. So actually, from there, we know that the guideline is not disseminated properly, and also we know that there are so many news, so many hoax regarding to these the PPEs. Like you have to, like mostly the healthcare workers in Indonesia, they wear almost everything that they can wear in a way to protect them. So it doesn't mean that they don't know, or it doesn't mean that they know. So there's a possibility that they don't know, they not get informed, or also there's a possibility that they know, but they just want to protect themselves.
Yeah.
And I think the COVID-19 is like a really, it gave us lots of lessons in a way that how we should follow this, and then how our efforts is to combat the COVID-19. And in the hospitals, I think now the situation is getting better, if I can say, and the regulation is also spread quite wide. And then the healthcare workers in hospitals, they're already well informed about the PPEs, and also about the extended use of PPE, which is not really needed for them to be used in the hospitals while they're facing the patients. I think, that's one of the reasons.
Yeah. So, and then I think we have 5 minutes left now, when I understand well, but Helen can inform us about that, Brody. I was wondering about the self-assessment. Juliette mentioned that there are documents that people can do self-assessment for the compliance. But I was also now trying to make the link with the farmers, when we are talking about the units, so the unit of hospital and the unit of farms, they are more or less, then we compare them. But what kind of knowledge do you need to do this self-assessment? Because I think that if you want to have farmers doing that will be really difficult for them to do, because they are on their own farm, and they think they are I think quite sure that they are doing their job right well. When you are, Juliette, or Indri, in the hospital, I think you can point people and say to somebody from the surgery department, you are doing something wrong. How do you see that for farms? Maybe Juliette first, and then Anissa. What for options you see there?
Yeah, so I think for a large part, the questions in those self-assessments, well, they're made by the WHO and validated very well. So I think they are focused also on that it's feasible to do also for smaller hospitals without infection prevention practitioners. But still, I think if you would translate such an assessment to farmers, well, I'm still from the human field, of course, but I can imagine that you would really try to make the questions as easy as possible. For example, and this is also the kind of questions that are used in the self-assessment for hand hygiene, then they ask you, please walk into a room, and how many patients are there, how many healthcare workers are there, and how many bottles of hand alcohol hand rub is there. So that's easy to count. So this is also something I can imagine you could ask to a farmer. So is there a bath for your boots? Is there any disinfectant in it? And when did you change it for the last time? And I think by asking such questions, you can already raise awareness to the farmers. But this is just one example. I'm glad to hear Anissa's opinion as well.
Can you keep it short, Anissa, because we are now close to the end. Yeah.
Sure. Agree with Dr. Juliet. Beside the simplifying the question for the self-assessment, I think for the farmers, I think you have to make a system that enforce them to actually do the self-assessment itself. Because unlike the hospital settings, for the farm setting is really a lot of factors that can make the self-assessment become hard to do. So the enforcement for that is really, really needed. I think that's all, bro.
Okay, so we are at the end of our session. I enjoyed it, I have to say, with seeing the differences and seeing the commonalities. So I'd like to thank the speakers, Juliet, Nisa, Dinati, and Indri for their very nice contributions. I think there is a lot of work to do, more in general, on this topic. And I think now we are in we meet each other in some projects. I think we can continue the discussions about it and see how we can learn from each other. And I like to thank Nuriani for also for co-chairing. And I like to ask to thank Rihanna, because she is always good in helping us out when there are digital problems. So. And of course, the winner organization team for giving us the opportunity to share our results. So thank you, and have a good day wherever you are in the world at this moment. Bye.